Hi all, welcome back to Nursing Guru for another live session which is regarding the foundation of nursing. Okay, so everybody knows already about this foundation or fundamental of nursing. So this is the one of the important and vital subject in the nursing. Okay, so today I'm gonna give you the important questions and certain suggestions and as well as how to tackle the examination is very important. Yes, we know that we will get the important questions everywhere around in the Instagram or in the YouTube channel, or if we are getting from the chat GPT also. But the thing is that if you don't know how to write the examination, where you have to focus, that is definitely going to be hit you to fail, okay, in the examination. So that is why if you are asking about this foundation revision classes, you are going to see hardly 30 to 45 minutes of class we are taking, and in that particular class only we are revising. Okay, with you guys we are helping you to revise the things. Okay, so you just glance with my class. I'm not going to tell you to that I'm giving whole syllabus and whole things are going to be explaining in front of you. Okay, is that possible, my dear students? If you want to write an exam, you have to wait for a 1 year, right? So to finish the entire curriculum, which means what? The syllabus. Then you tell me within the 15 minutes of time, how can I able to finish it off this entire syllabus? It is not possible. Only we are going to give a recap or the revision of your entire syllabus. If you have any doubt, you could have able to contact us in the live chat box. Whatever the doubt you have, also ask me. I will explain you. And my motto and our nursing guru motto is that you have to pass in the examination, because you have to excellence in the education from the field of nursing. That is our intention, vision, everything. Thank you so much. Okay, let me start my classes. See, here we have certain classes. So certain classes will be there here. So regarding this one, so we have around um, 8 units mainly. Okay, so the 8 unit will be there in main content, and the second is the module, that is first aid. Okay, so from the first aid we have again lot of things. Okay, so that is what we are going to be studying today. Okay, so now I will going to teach you the first unit. Okay, in the first unit we have the nursing concept, meaning, definitions, okay, scope and functions. Okay, so in the first unit always, okay, introduction to. So here the basic information, which is like, definitions, concepts, principles. Okay, concepts are nothing but ideas in psychology, but here also the certain concepts they have used right now. So those are the things we are going to be study in this particular unit. Okay, so along with that, history of nursing in India, pre post independence, that era was there. No, who brought the nursing to the India? That is and all you already know, or know it very well. Okay, I'm not going to tell you that things are very important for you, but only in the sake of examination, sake of knowledge, you have to know about that. Nobody will going to ask you explain about the history, how Nightingale was came to India and introduced the nursing. Nobody will going to ask you. Okay, what is even they are going to focus more on the principles, objectives, okay, aims and concepts, definitions. Okay, so there they are going to focus. Now you know the definitions, right? Now you know the concepts of nursing, right? Now you know the principles of nursing, right? Okay, so that you have to focus more, my dear students. Okay, so the next thing we will move towards the nursing as a profession. Okay, so as a profession, whatever the things, ethics, especially ethics. Okay, so ethics will be there, and thoughts will be there, intentional thoughts and unintentional thoughts, everything, ethical and legal issues will be there in the nursing. And what is battery? Okay, one thing I will explain. Battery is meant without touching without getting a permission, we are going to be touch the patient without their permission. Okay, so that is a battery, right? That is one of the taught. Okay, so ethical. Okay, what are the roles and responsibility as a nurse? Whatever the ethics you should follow, that ethics you have to study. Okay, so you should be responsible, you should be provide a proper care in that. While providing care, you have to be, genuine care you have to provide. You should not be malpractice. Okay, malpractice should not be used. Okay, so those are all the not good ethics, right? So avoid the malpractice and all. The next one is malpractice in the sense that you're not supposed to going and giving a unwanted treatment to the patient. Okay, so that and all you're not right to do that. Okay, next one is that ethics in nursing roles and responsibilities over healthcare agencies. Okay, for example, healthcare agencies, hospitals. In the hospital, two things will come: government hospital and private hospitals, and the clinics will come. Okay, so those things you have to study. And community services, types and functions of the hospital and health team. Hospital health team, the entire members will comes in hospital health team. Nurse, doctor, staff nurse. Okay, so nursing officer, and as well as the lab technician, and we have the attender. Okay, so and we have the multitasking worker. Okay, so those are the everybody will be there. No, the team, entire team will come. No, that you have to write. Pharmacist will be there. Okay, so the entire team, according to based on the type of hospital, the team has to be going to be designed. Okay, who all needs to be there in the particular. Suppose one clinic. Okay, how many nurse we need? One or two nurses enough to render a clinic. Okay, so if we want to render a hospital, means the staffing pattern will also going to be different. Okay, that and all the knowledge you have to get. Next one, modern approaches to nursing care, including the holistic nursing care. Holistic, yes, we are in the era of holistic care, curative, preventive, and promotive care. In the whole care we are providing. Olden days and all, how it was there, my dear students. There was the era once we got a disease condition or health issue, then only we supposed to going to the hospital. Okay, now the era is going to be changed, the trend has been changed, and we are providing preventive, promotive care to the society and the community people. Okay, so why I'm telling yesterday I have observed in diabetic patient, they are telling that diabetes, so they are underwent diabetes, they don't want to transfer to the next generation. Their perception is that, suppose I'm telling, then they have told how we need to avoid to transfer from the we should not going to get this condition through heredity. Okay, so some cases they will not get, some cases for sure they will get the things. Okay, so this diabetes, so that kind of cue, that kind of nowadays everybody were going to be promote their health before going to get the disease condition. That is very important. And next one is health and disease. Okay, so the entire health and disease, health is a complete state of physical, social, and spiritual, emotional well-being, not merely the absence of disease or any infirmity. Okay, so this definition will be given by the WHO. So there may be asked in the 1 mark, that is for sure. The next thing is that we have the things like disease. Okay, so absence of health is called as disease. Definition of health, determinants of health, and health status. Okay, next one is that basic human needs. Okay, so Maslow's hierarchy of needs will be there, so in that basic human needs also will be there. So those two needs you have to study thoroughly. Okay, shelter, power, so those are the basic human needs. Okay, health. Next, illness and its effects on individual, the stages of illness and its effects on individual, how illness will going to be impact on the health of the people. So this is all about the first unit. Now I will go with the second unit, nursing care of the patient. Okay, so second unit is nursing care of the patient. So all are nurses only watching now. PT means patient. You people know already. So here now, so in this patient environment in the hospital patients unit. So what are the patient environment in the hospital patients unit? So certain environment we have to set down. Okay. So we have to, what is the environmental theory has been taught by the Florence Nightingale. Our environment should be good, then only our like the It will boost up the self concept of the patient, and as well as we will get the result also in soon. Outcome will be very easy. Okay, so next one, proper ventilation, proper lighting, everything matters, right? So the next one, therapeutic environment. So therapy is a treatment. Okay, therapeutic environment everyone should maintain in the hospital. Next one, physical factors like lighting, temperature, ventilation, humidity, noise, patients. Okay, so these are the things of physical factors. Safety needs of prevention of all environmental hazards. Okay, so here it will come fire extinguishers. Okay, so fire accidents. Okay, so or any kind of things which will affect by the other environmental hazards. Psychosocial and aesthetic factors, and patient's adjustment to the hospital, understanding the patients as a person, socio-economic and cultural, see, background and health status. That is one of the very much important responsibility of a nurse to know about this one. Next thing, we are moving towards the basic nursing skills: communication, nursing interview, and recording and reporting, and nursing process. Okay, so first basic nursing skill, we have to communicate with the people in a very good way. Communication is very much important, my dear students, because what you are going to supposed to send a message, the things are matters a lot. Suppose you are going to tell afternoon, you take something, afternoon doctor has been announced, like doctor has been written the order to provide medications to the which one, patient, but you are means to take a tablet, but you are going and telling morning, what is the use? Okay, so that is a egg error. Okay, so the drug error. So these are the things you should avoid. Okay, so that is why you have to focus more on the things. Next, nursing communication is very important. How to interview, you have to interview the patient with a very, see, always whatever the stress you have, duty stress, that this it is not a issue. Okay, so we already taken a oath, we will, in irrespective of our anything, we are going to provide a care, right? So you have to interview with the proper guidelines you have to follow, and you have to interview them. Recording and reporting. Okay, so recording and reporting, whatever the procedure you have to done for the patient, you have to record it, and you have to report to the doctor or the superior authority in the hospital. Nursing process. Okay, so this assessment, okay, assessment, diagnosis, implementation, evaluation will be there, no? So the entire process will be there, no? So that 6 process will be there, no? So that is you have to study. Okay, planning, implementation, and evaluation. Next one is that meaning and importance, assessment, planning, implementation, and evaluation. That entire for steps are there, no? That you have to study thoroughly. They may ask the question regarding that. Okay, next, nursing care plan. Okay, so regarding the nursing care plan, what is will be there? Okay, so subjective data, objective data, after that goal, diagnosis, after that goal. Okay, so and after that, how you are going to write after goal? After goal, intervention, I mean implementation, and then after you are going to supposed to know about the evaluation. So the entire nursing process is there, no? There only we are going to write in the care plan. Okay, so second unit over here, we are expecting the things like admissions, transfer, and discharge procedures. Okay, so those are also very important. And we are expecting, like, communication, nursing interview, and recording and reporting. Based on that, especially assessment, implementation, evaluation, planning, implementation, evaluation. Intervention is means planning only. Next thing is that meeting the basic needs of a patient, physical needs, third unit. Okay, so meeting the basic needs of the patient. Okay, second unit I have told all the things. Next, meeting the basic needs of the patient. Okay, so in this meeting the basic needs of the patient, you can see over here that physical needs, comfort, rest, sleep. Okay, so and exercises, importance of its promotion, and body mechanics, and moving, lifting, and transferring in the body mechanics. And after that, you have to focus on the things like, position and posture maintenance, positions. So this unit is very important in sake of practical examination also. Okay, so positions and comfort devices, beds, bed making principles, and principles of the bed making, everything you have to study. Safety devices, restraints. Okay, so this safety devices will be there, no, so that restraints and all, so that and all you have to focus more. Okay, next one, hygienic needs, personal and environmental hygiene, nurses role maintenance and the personal environment hygiene and a care of eye, nose, okay, entire things. Okay, next one, nutritional needs, diet, health and diseases, factors affecting the nutritional illness, malnutrition, nurses role and responsibility of patient with the nutritional need. Okay, then examination, elimination needs, health and sickness. Okay, so health and sickness problems, constipation, diarrhea, retention and incontinence of the urine. And we have that nurses role in meeting elimination needs, offering a bedpan and urinal to the people, and this is also very important in the sake of practical exam. Okay, next one, psychological and spiritual needs, importance of psychological needs, diversional and recreational therapy, and in that role of nurse is very important. Care of terminally ill and dying patient, that is one of the very much important topic. Okay, so under that medico legal cases. Okay, nursing care of dying. Okay, special consideration, advanced directives, euthanasia and you will or dying declaration, organ donation, etc. These are the area you have to take the responsibility. That is very important, 1 mark they may ask these questions. Okay, so care of unit to autopsy. Okay, what is this autopsy? Self decision making capacity of a nurse. Okay, everyone should have the autopsy to uh, take a decision. That much knowledge if you have means definitely with the confidence you will take the decision. Okay, next one is hygiene, personal hygiene and mental health and hygiene. Okay, so two things will come. Personal hygiene means external and internal hygiene, whatever we are doing, that is the personal hygiene. External, especially to prevent from the infections or any kind of diseases, to protect the diseases, that is what we are doing. Mental health and hygiene, concepts of mental health and hygiene, characteristics of physically and mentally healthy person, mental hygiene in intrauterine infancy, child and old age. Okay, so different stages of life is there, no, according to that mental hygiene will going to be different. Okay, so that you have to study. Next to for fifth unit, assessment and patient, assessment of patient or client, physical assessment, physiological assessment, psychological assessment, and we have the infection control in this particular unit. Physical means importance, principles, methods and assessment, height, weight, that physical examination we will do, no, the same things. Next one, physiological means vital signs, normal, abnormal, characteristics, factors influencing the variations, observation, collection, specimens, urine, stool, that's and all, you know, systemic examination we are doing under the physiological assessment. Okay, assessment means what? Going to be no assessing. Next one is psychological assessment, in that mood, intelligence, emotions and normal and abnormal behavior. These are the things are very important. Next one is infection control. Infection control, nature of infection, chain of infection transmission and define against infection, natural and acquired. Okay, so infection, hospital acquired nosocomial infection is very important topic over here. Okay, so this one is very important, concept of asepsis. Okay, medical and surgical asepsis, isolation precautions, barriers in nursing, hand washing techniques, so surgical and common hand wash. Okay, so the next one, isolation, personal protective equipments, like you know, types of personal protective equipments, PPE. Okay, glove, mask, then after gloves, mask, gown. Okay, cap, hair cap, everything. Next one, biomedical waste management also will comes under the sixth unit. Okay, so fifth unit only assessment of patient care, physical, physiological and psychological assessment. Sixth unit is infection control. In the entire infection control, nosocomial infection or the hospital acquired infection, HAI, is very much important. Okay, along with that, you have to know about the biomedical waste management also, sterilization, disinfection. Okay, so those are very important. Next we will move towards the eighth unit. Eighth unit, we are having a therapeutic nursing care, care of patient with the respiratory problems and breathing and coughing exercises, O2 inhalation, that is also very important, dry mouth inhalation, oronasal suctioning, care of patient with the altered body temperature. Okay, so these are the things will comes under the therapeutic treatment modalities. What we are using, therapy means treatment. Okay, so care of patient with the pain. Okay, we are by using the pain scale and all, we used to assess the pain of the people, and after we have to provide a care. Okay, so by administering the analgesics as per the doctor's order, we have to reduce the pain. So this only we are doing, right? So these are all we are studying here. Okay, next one is introduction to clinical pharmacology, certain medications, purpose and principles of 5 rights. Okay, drug administration rights will be there, no? Right patient, right route, right time. Okay, right dose, right evaluation. Okay, right to evaluation. So these are the things you have to focus more in this introduction to clinical pharmacology. Okay, so that is very important. After that, for you guys, we have role of nurse in the administration of medication, type of administration, and you have to know about the cannulization, you have to know about the type of injection, site, route, everything will cover here. This is one of the very much important. Either you will get the longest setup of question from here, or you will get the short notes. Pakka question will be there from this particular unit. Okay, so these are very important. Hope you guys are understood. Now I will tell you this first aid. Okay, so first aid also we have certain content. So it's all about 4 contents will be comes under the first aid: introduction and procedure and techniques used in the first aid, and we have the first aid in emergencies, community emergencies and community resources. These are the 4 things will comes here. So definition, aims, importance and first aid, rules, general rules and principles will going to follow in the first aid. Concept of emergency will be going to study in the first unit. Okay, so those are the important concepts you have to study thoroughly. Okay, so in that also principles were very important. Define first aid, they may ask in the meaning of the following, and the concept of emergency. Okay, next one, procedure and techniques in first aid. Okay, so procedure and techniques also very important. The preparation, how we need to prepare the first aid, dressing, bandaging, splinting. Okay, so this types of bandages. Okay, transportation of injured, CPR. Okay, so the entire CPR steps, ratio of the CPR for adults, children. Okay, so that you have to study thoroughly and go. Next, first aid in emergency: asphyxia, drowning, shock, wounds and bleeding. That time whatever the principles and the procedure you have to follow. Injuries to the bone, joints and muscle, fractures, sprains, strains, hanging, falls. Okay, so these are also very important. And poisoning, burns is very important in sake of your examination. And foreign body in the eye or ear, nose, that management. These topics whatever I am telling, no, only management you see from this unit. Next one, community emergencies: explosion, bomb, that kind of things they have to put, right? Floods and earthquakes, feminines. And next one is that famines. And we have a role of nurse in disaster management, rehabilitation, to bring back, how we are bring backing that one. Community resource, policy, ambulance services, voluntary agencies are the very important things you should know in this particular subject. Okay, so now I will tell you the questions you may take now. Okay, so the questions are very important and you have to study. Define nursing. From the first unit, define nursing, explain the philosophy, aims, objectives and functions in the nursing. Okay, explain the qualities and responsibilities of the professional nurse. Next, discuss the scope of nursing in India. Then explain the roles and functions of the nurse in different healthcare settings. Okay, so role of nurse is very important in the nursing foundation. Whatever the procedure they may ask also, except than this topic, you have to write the role of nurse after completion of writing the answer. That is the key point to secure a good marks in the nursing foundation. You have to write the role of nurse. Next one is short essay. The nursing profession, nursing ethics, professional etiquette, qualities of a good nurse, expanded role of the nurse are very important. Nursing, health, illness, professionalism, accountability, autopsy are the meaning questions, 1 mark questions. Okay, next one we will go with the second unit, health and illness. Okay, define health and explain the dimensions and determinants of the health. That is very important, they may ask this question. And explain the concept of illness and illness behavior. Okay, so that is also very important. Discuss the factors influencing the health and illness. Next one, explain the health and illness. Continuum is not for you, so no need to study this. Quip, you just skip this. Continuum is not for you. Okay, means how the illness person is going to travel towards the health and how it will be going to travel, vice versa. That one is there, that is not for you, leave it. Then the short note, sorry, short as a short answer like health, illness, wellness, disease, risk factors, holistic care we can expect from here. Next one, hospital admission and discharge. From this particular topic wise I'm telling, so from that at entire important questions I will tell. Okay, explain the admission procedure and nursing responsibilities, and describe the discharge procedure and nursing care. Explain the transfer of patient, this lama dama they used to do, no, this lama also one of the very important question. Next one, admission unit, discharge planning, medical legal cases, patient orientation, discharge advice is the very important. Next one is short notes, admission, discharge, transfer, referral, consent. Okay, short notes is not 3 mark questions. The is na, these are the questions for meaning, 1 mark. Next one, communication and interpersonal relationship. From that particular topic we are expecting define communication, explain the communication process and barriers. Okay, so these are the things will come here. Nurse patient relationship, verbal and non-verbal communication, that is also come. Then basic nursing procedures, from that particular things, principle on bed making types, there may be asked for the longest type of question for sure. And care of bedridden patients, terminally ill patients, that is also very important. And explain positioning and positioning of the patients and nursing responsibilities, bed making, pressure sore prevention, comfort devices, body mechanics, positioning are the important things you have to focus. Okay, so those are the area you have to study. If you are not studying, take a note and write, and these things you have to quickly revise. Okay, so from this only will come. Next, procedures over. So here personal hygiene, from that explain the importance of the personal hygiene, complete bed bath, explain, discuss the oral hygiene and dental care or the denture care, or explain the care of eyes, ears and nails. Okay, hair and nails are also very important. Next, here only short answer type of questions like 1 mark, pediculosis, oral hygiene, nail care, bed shampoo and sorry, bed bath and perineal care. These are the 1 mark questions. We have vital signs now. So from the vital signs, we are expecting the questions like temperature, pulse, respiration, all the vital signs will be there, no, blood pressure and the pain assessment. So those are the things you have to focus more only. Next, fever, hypothermia, tachycardia, bradycardia, hypertensions are very important. So the next one we are moving with the infection control. I already told you nosocomial infection is one of the very much important topic in that, and infection control, explain the chain of infection and methods of breaking it. And next one, describe the this isolation and all will be there, no, isolation that you have to write. Then describe the medical and surgical asepsis. Next one is that explain the hand hygiene and biomedical waste management. Discuss the standard precautions and transmission based precautions. Okay, so hand washing, sterilization, disinfection, isolation techniques, biomedical waste management, personal protective equipments, autoclaving, nosocomial infection, cross infection, disinfectant. These are the major area you have to focus. Okay, so why I'm telling, only the things are very important, that only I'm telling. I'm not going to tell you that everything you have to cover it off. Okay, so this much if you study, that is more than enough. There, then and there itself only you are going to cover all the 1 mark questions also, including the fill in the blanks and as well as the true or false. Next one, safety needs. Safety needs, explain the accident prevention in the hospitals and describe the safety measures in disaster preparedness in the hospitals. Explain the patient safety and fall prevention. These are the things are very important. Hospital hazard restraints. Okay, safety comfort devices will be there, no, that and all. The next one is fire safety, electrical safety, patient identification, side rails, fall prevention, hazards and restraints, and we have the incident report. Okay, so these are the major factors they can ask in the 1 mark. Next one is the diet nutrition. Okay, so from that particular topic we are expecting explain the principles of balanced diet nutrition and describe the nursing management of patients with receiving enteral feeding, so parental feeding. And next one is that explain the nasogastric tube feeding and nursing care. This is also very, very important, nasogastric feeding. Okay. Next one, balanced diet, therapeutic diet, NG tube feeding and feeding the helpless patients, nutritional assessment, malnutrition, BMI, and we have a enteral feeding, parenteral feeding and aspiration. These are the very, very important. You have to focus there. Next, we are going to be see that elimination. From the elimination, explain urinary elimination and factors affecting it. Describe the bowel elimination and nursing management. Explain the catheterization and nursing responsibilities. Discuss bowel training and prevention of the constipation. Enema, catheter care, types of catheter we are using, insertion, position, and as well as the whatever the side effects which will be going to be experienced, no, that and all. While explaining the answer you write. Okay. Next one, urine specimen collection, how to collect the urine specimen collection. Okay, so that is all. In constipation, urinary incontinence, oliguria, polyuria, dysuria, enema and catheter are very important. From this one, no, pakka they will ask you. Okay, nocturia, what is nocturia? Urination in the night time. Okay, so in the bed itself they are going to, usually we are seeing in the children. Okay, so that is what nocturia. Noc means nocturia, noc means night, urea means urine. Okay, so that is what you should learn like this. Okay, so these are the very important. In sake of practical exam also they are going to ask this only. Okay, so while writing these or all the answers, you write it in a good way, good handwriting. Next we have long essay, rest and sleep. Okay, so there also sleep cycle, insomnia, relaxation techniques, bedtime care, sleep hygiene. Okay, so these are all will comes under the physical hygiene. Okay, physiological hygiene will be there, no, there it will come. Next one, discuss the factors affecting the sleep in nursing intervention. Explain the common sleep disorders including nursing care. Explain the importance of rest and sleep, that is very important. Cardiac rhythm, cardiac rhythm, sorry, circadian rhythm. Next one, insomnia, sleep hygiene, fatigue, rest. So auto administration, that procedure is there, no, that you also focus. Documentation reporting will be there. So these are the things. Okay, so nurses notes, incidents reports, shift and report, major topics I have told you. Okay, hypoxia, cyanosis, nebulizer, oxygen cylinder, suctioning when it comes to oxygen needs, oxygenation. Next one is that explain the tracheostomy care and nursing management. These are the things are very familiar for you also. In the first side also we are expecting lot of questions. Okay, so most of the questions we are expecting disaster cycle. Okay, so that cycle and all will come, no, that one disaster prevention, so that will be there. Okay, so infection control, nosocomial infection, don't forget to study. Okay, that is very important. And vital signs, all the vital signs, one question will be there. And nursing fundamentals and professional roles, role of nurse for each and every procedure you have to write it down in the examination. Only is the key to pass in the examination. Study, first is study properly. Okay, second is that you have to fill the answers. Okay, so you have to fill the answers with the proper handwriting and the proper schematic representation when it comes to RGHS examinations. Okay, so instead of writing a story like any kind of things, like people used to write like a simply, someone I saw that he will be only a, who will understand what is this? Okay, so you have to write properly. One word I am writing. Okay, so I am writing like this. Who will understand? You people are not going to understand, right? So that is why write in a good handwriting, write in a very better kind of representation, presentation skills you use. Okay, suppose this is a paper, write, it's not looking good. Okay, if you are writing like that, definition, write it, definition, according to whom. So why I'm explaining this one, you failed in one time, right? So these are the lack of information, nobody knows this. Okay, so that is why, if you have any doubt, you could have comment down. Most of the things I have already told. I'm gonna finish it off my live, and you know, if you have anything, you can comment it off. Otherwise, we will saw in the next time. Okay, so you want anything, you can discuss with me, no issues. Okay, tell me anything you want. All are watching, I can see you all are watching. So you tell me what you want. So these are very important when it comes to first aid, cover it of all the things which is necessary, emergency management and all, you have to focus more. Okay, so and arrangement of the police ambulance. Okay, so entire first aid management you have to study thoroughly and go to the examination hall. Okay, so so far we have discussed lot of things. I have told no that questions you may going to be get in the tomorrow's examination. Why? Because anyhow I know that chat gpt also going to give these questions. Okay, no, nothing is there, but we are analyzing the previous year question papers, and we are picking from that, okay, which is important. Hmm? That questions only we have discussed. Okay, one second, I will continue little bit of things. So they may ask like you define hospital team members. Okay, healthcare team members, types of hospitals, that is also very important. And regarding the burns also they may ask fever. When it comes to vital signs, define fever and list the types of fever, how you will manage the and treat the patient suffering from the fever. Okay, so that is what they are going to ask. Okay, so that kind of questions, fill in the blanks, that and all will be there. You are knowing already the paper pattern. I'm not going to tell you that. So if you have any doubt, you tell me, I will tell you. And all the questions, write a role of nurse. Okay, whatever they may ask, no, any procedure, bed making, that, this, and all, you have to put a role of nurse. Okay, that is very important in sake of your to get pass in the examination. What is the use paying a lot of fees and not at all passing? What you are told to your parents and all, you are not able to give an answer for them, right? You have to pass, get pass and enter to the profession. Your life will change definitely. So study better, go and revise the topics whatever I told you. Okay, so we will meet you in the next